hepatitis A outbreak in Minnesota includes 23 cases in these 9 counties, a majority of them in the east central part of the state. 13 of the people in these cases needed to be hospitalized. So, what is hepatitis A? It's a contagious liver infection caused by a virus. How do you get it? The virus most commonly spreads when you eat or drink something contaminated with fecal matter from someone who has the virus. There are many possible symptoms, including fever, vomiting, clay-colored stools, dark urine, and jaundice. The CDC says although it's rare, it can cause death. Nationally, there have been more than 23,600 cases in 29 states, part of the same outbreak we're seeing here in Minnesota. The Minnesota Department of Health says it's been seeing an increase in cases since May.
Since 2016, there's been an outbreak across multiple states of hepatitis A. And it has been focused in 3 risk groups.
Those groups include people who use street drugs, those experiencing homelessness or unstable housing, and people who are or have been recently in jail.
You've got people that are probably interacting in very close quarters, so that's a function, and they may not be in the most sanitary conditions.
MDH says the best way to prevent hepatitis A is to get vaccinated, something they're helping with in those high-risk groups.
So we're doing outreach in jails, we're doing outreach to syringe service providers.
The hepatitis A vaccination has been recommended for kids since 2006, but many adults have not been vaccinated for it.
It's really anybody who eats probably should consider the vaccine.
For KARE 11, I'm Heidi Wigdahl.
Now, the health department wants to be clear. They're not saying you have to get the vaccine, but if you want to or you're concerned, you should reach out to your doctor.